way back down to the beginning. If she's up here, you can then have a little bit of overpressure applied. Any pain with that?
No.
So when I first start to feel the resistance, that's where I stop putting the overpressure in. With what we've been seeing before has been, you know, at the ankle and at the knee, that everyone's trying to like take up as much motion and crush the joint. You're not having to like lean in here and then take a measurement. Once I start to feel that first little bit of resistance, you can then align and then relax down. So I've assessed my end feel, and with that I got to 135 with overpressure, with the passive motion. So any questions with flexion?
Are we supposed to pay attention to the other thigh and make sure it stays on?
Yep, exactly. So Julie has good motion here. So if she's coming way up and you're starting to see this start to elevate in this hip flex because of posterior pelvic tilt. So as you're going through, another thing to note is to see how much motion is occurring there. In this case, there's not very much, and it kind of coincides. When I first start to feel that resistance is when I first start to see a little bit of motion. So then that way I would be holding there and stabilizing, and then you can go into your alignment that way, as opposed to trying to read it. If someone has black shorts or black pants on, is, you know, if it's locked here, have the patient rest down, and as long as this isn't moving, you can then come and check your measurement here. So you don't have to visualize it with them on, especially with the black pants. It makes it kind of tougher to see for people. So questions with that one? Since she's supine, we're going to get into AB and AD adductions. So could I have you scooch to the table as close to me as you can? Again, ideally practice this on the low mats because there's a little bit more real estate. These are pretty narrow plinths anyway. So for hip AB adduction, Julie, I'm gonna have you bring your leg all the way out to the side towards me, and then back to the side. Any pain with that at all?
Nope.
What I'm noting here is excess side bending of the pelvis to see if she's starting to get that motion through the lumbar spine. So what you can do, so come AB duct all the way, keep coming, keep coming, keep coming. So you see that, and you're coming back. So if I start to see that, so AB duct for me, good there. I'm gonna have you stop. So you can stop their motion because that is about where it looks like that her hip is ending. The alignment, so you're gonna be on the ipsilateral, ASIS. The proximal arm is going to be in line with the contralateral ASIS, and you're making sure that the distal arm is would continue to bisect the patella. And in this position, she has about 50 degrees of abduction, 45 is norm. And for your passive, again, you're into the position here, and you can palpate the pelvis to start to, you can get the end feel, but you can start to sense some motion here. It's indicating that that motion's coming through the lumbar spine. And take just a second to palpate. Or about 50 with the same there too. So, but again, normal hip, normal motion, we should see symmetry, if not just a little bit more passive motion. For any questions with that one? All right, you can see why having a wider table, using the ones in the back, especially for those who might have longer legs, and you'll see why with AD adduction. So we're going to measure, just since Julie's already on the right side of the table, we're going to AB duct the hip that we're not going to be measuring. Something you want to be careful with is that you're not AB ducting it so much that you're altering the position of her lumbopelvic alignment. So what I'm going to have you do is, can you bring this leg across towards the opposite leg and then back to the resting position? Again, one more time, and good there. So what I'm feeling for is to make sure that she's now not side bending away to get more of that motion. So then you can stay as close to normal alignment. Now that fulcrum goes over the, again, that ipsilateral ASIS, aligned with the contralateral. And AD adduction, she has 31 degrees. And the nice thing with these ones, at least, is once you find the position, you can just rest the leg. You don't have to worry about holding it in this case. So if you're starting to try to assess the I start to feel resistance and pull there. Now you can just let the leg relax. Don't worry about trying to help stabilize and support it. You got to worry about that with there with a little bit of passive. We got a little bit more to 35 degrees. And then you can relax there. Questions with those two? Good. The enthusiasm. Could I have you on your stomach, please? That Scott did not volunteer for this one. So, hip extension. So again, your alignments are the same for the hip flexion. So again, I found greater trochanter here. I can tell visual estimation, she's at least at her 0. If you see someone that might have tight hip flexors or it looks as if the hip is flexed, again, take that for your starting position. Could I have you keep your leg straight and lift the leg up off the table for me? And relax back down. Can I have you do that one more time? And start to screen the motion, and can you hold there for me? And relax back down. So extension, we got about 20, 21 degrees. In the case of passive motion now, give yourself a little bit of a mechanical advantage here too, protect your back. So what you're going to be doing is you're going to go ahead and just relax this leg as best you can. What I'm feeling for is when I start to see excess motion at the pelvis. You should feel a little bit. It's when you start to get that it's excessive. And relax as best you can. Musa. There we go. And again, that's where I feel like I'm starting to lose the pelvis there. And with that, we got about 25, 26 degrees. Passive hip extension. So, any questions with that one? Would you like to show your